My name is Philip Holmsiner. I'm a principal investigator at the Medical University of Vienna, and my lab is interested in the innate immune system and the processes that are working around it. So we were working for a while now with COVID infections, and we established a mouse model that allows us to follow COVID infections over time. And my team and I were very interested in to see if there are any effects after virus resolution. So we looked in our mouse model for the markers of inflammation and activation of the immune system. And surprisingly, we found that even after days of full virus clearance, we still were able to find inflammation and a prolonged activation of the immune system. So we were wondering if that is something that's unique to our model, or if that's something that can be seen throughout species. And that's where we wanted to confirm our findings in a human population sample. That brought us to the ISIDORe project.
My name is Lukasz Kozera, and I work as a scientific program manager for BBMRI-ERIC. I'm in charge of the ISIDORe project, specifically for Work Package 8, which is facilitation of access to clinical samples and data. Our mission is to make sure that scientists from different European research teams can establish cooperation with our biobanks to perform scientific research at the highest level. And the idea of the ISIDORe project is also to show the mobilization of the scientific community to respond to future pandemic outbreaks.
My name is Vita Rovita. I'm head of Latvian National Biobank, genome database of Latvian population. I'm also a head of national node of BBMRI-ERIC Latvia, that is infrastructure for biobanking in Europe. Our biobank is consisting of over 40,000 participants from Latvian population. The biobank consists of both population-based cohort and disease-specific cohort. One of the disease-specific cohort is COVID-19 patients that were used for the ISIDORe study. A COVID-19 cohort in our biobank was created during a state research program for mitigation of consequences of COVID-19. And we developed specific design where we recruited COVID-19 patients during acute phase of infection, and then several follow-up visits after 1 month, 3 months, and year and a half of acute infection. Therefore, we had the opportunity to follow up the COVID-19 infection and potential consequences during several initial stages of infection and recovery.
So the application from Professor Hohensteiner was relatively straightforward. So they were searching for specific plasma samples which were found at Latvian Biomedical Center. And our aim was actually and our goal was actually to analyze the DNA request and make sure that we found appropriate samples when it comes to quality criteria and certain clinical criteria that were important for the research group to combine with the research data.
So to obtain the samples from Vita was surprisingly easy for us. The ISIDORe team was very helpful. We had Lukasz as our main contact to make sure that everything ran smoothly. I think overall it took us 4 emails to have the samples shipped to Austria and allow us to start the work in such an easy manner.
I think this project in collaboration with Philip worked very well, because in our biobank we have already developed all processes from the initial request of the samples, following ethical permission and material transfer agreement templates that we had already in place. Therefore, the communication with the researcher and all the necessary steps and procedures were very streamlined and fast. And this is a high added value for every researcher and biobank to collaborate in that way. ISIDORe project was very valuable to our biobank because it helped us to connect with other researchers all across Europe and represent our resources, data, and samples that we had in our biobank for COVID-19 research, and potentially beyond for other collaborations and research studies.
we wanted to be able to explain why we observe more cases of adverse events in patient populations, like in cardiovascular disease patients, that you have an increased number of strokes or of myocardial infarctions that are timely not directly connected to a virus infection or to the SARS-CoV-2 infection, but they are in close vicinity. And we wanted to make sure to understand the effects that the virus infection has on the long term on the human population. And I think with the help of the plasma samples from Vita, we were able to demonstrate that really the effect is a long-lasting one, and that we have an effect that lasts for months. And so we have to be sure that we control the pandemic not only in the initial phase, but also throughout the phase where the virus effects are still measurable, but the virus infections are long gone.